Hello and welcome to South Segment, the special focus on news from the south of the country. And today the focus really on Bengaluru and what the city is doing right when it comes to curbing the numbers of the COVID virus. The Chief Minister held a meeting with officials earlier today and he came out with several announcements. He spoke about the state's mortality rate at 1.2% being better than the national average of 2.8%. The state's recovery rate of 56.5% is against a national average of 51%. There are totally 71 labs in the state now, 41 government and 30 private labs. The total tests conducted so far in Karnataka stands at 4,40,674. Now, of the 7,000 cases that there are in Karnataka, many of them, over 4,300 in fact, are from people who have come back from Maharashtra. Quarantine for people coming from Maharashtra stays at 1 week institutional and 1 week home quarantine. But in addition, today it was announced that travelers from Delhi and Chennai would have to be in institutional quarantine for 3 days, followed by 11 days home quarantine. And finally, Mask Day. Yes, these omnipresent things, Mask Day is going to be observed in Karnataka on Thursday. So the state really taking COVID-19 very, very seriously. And we now bring you a chat from here in the BBMP War Room, where I am right now, on what Karnataka and Bengaluru in particular has done in order to keep the numbers relatively low. You can see that there's just 697 in this city of over 10 million people. So let's just see what the city has been doing straight from the horse's mouth. And welcome to the special focus on Bengaluru and what the city is doing right to keep its numbers relatively low. We're in the war room and we can see that this city of over 10 million people has 697 total COVID cases, 323 active, 338 recovered and 36 deaths. And while of course any case, any death is something that we want to avoid, the fact is that Bengaluru does have numbers which are much lower than comparable cities. Why is this? What's going right for the city? Joining us, we're very happy to have the BBMP Commissioner, Mr. B.H. Anil Kumar, and also Hepzibah Kollapati, MD of the Smart City Bengaluru and Special Officer in the BBMP War Room. Mr. Anil Kumar, is it a fact that Bengaluru is doing much better than other cities, or is it just perception? Is it reality or perception?
It is a reality. You can see from the data which is available that we are one of the flattest in the not only in the country but in the planet, and the numbers speaks for themselves. Since inception we have about 697 cases which are positive, and this is for a population of 1.30 crores in the city, and I think going by cities of equivalent population,
Yes.
we are one of the lowest.
One of the lowest. I mean,
Yes.
the flattest in the world. I mean, we're comparing with other international cities as well.
Yes, at the War Room we do a city-to-city comparison with the cities of India and also cities all over the world. When we look at the numbers, if we see per lakh numbers, Bangalore has 5 cases per lakh population,
Okay.
which is one of the lowest for a city of our population across the world.
Okay, other cities doing much, much worse in terms of numbers, I'm guessing, of course, in India and abroad?
In India, the nearest case has almost 50 cases per lakh population.
The nearest, above
Yeah,
that.
yeah.
50 cases per lakh population, and Bengaluru at 5.
Yes.
At about 5. So the next question, of course, for the other cities and for other places, what is Bengaluru doing right? What do you feel has been working?
I think what we did was that even before the Honorable Prime Minister could announce the lockdown,
Yes.
we had initiated a lot of steps by the state government, including Bangalore, of course, wherein we had closed down all the schools, the colleges, the malls, cinema theaters, the bars, the pubs. In fact, almost every place where people normally used to congregate had been shut down.
Even before,
Even before
the rest of the
even
country
before
had.
the rest of the country could come in. and we were, I would say that, almost in a state of readiness to go into lockdown. So that was, we had a 15-day period where before the lockdown was implemented by the government of India. So we were ahead of that.
A head start really
Yes.
on the lockdown.
We had a head start, and we were one, I would say that our city and our state had the first mover advantage
Okay.
in terms of putting in place the various restrictions which are required for ensuring a complete lockdown. And this was one of the, I think, the biggest advantages. The second advantage I think we had was in terms of aggressive contact tracing, which we put in place.
Contact tracing. So every positive case, whoever they met, it was absolutely done.
Primary and secondary contacts were traced, and one important thing which we did different from other cities in the country was that we picked up both the primary contacts as well as the secondary contacts.
So data actually was looked at very closely, and we have also identified something called as anti-contact tracing of late in collaboration with the professors from the Indian Institute of Science. And here we are looking at those clusters which are not in the already identified points as probable locations for spread of the disease. So data management and also trying to analyze on a real-time basis is actually helping us. The spatio-temporal analysis is actually helping us to contain the spread of the pandemic.
Absolutely, putting the smart in smart city really. You mentioned containment zones, and Bengaluru has also been quite aggressive when it comes to demarcating and enforcing containment zones despite resistance.
Yes, we were one of the first to seal down one of the clusters in Bangalore, which was a highly densely populated area and almost slum-like conditions. And we put in place a complete clampdown on movement of people from within the containment zone and outside the containment zone also. And we were able to ensure that whatever are the essential supplies which are required go into the containment zone. And that's how we were able to prevent the spread of this pandemic. And now the containment zone also has evolved, over a period of time. It was earlier a 3-kilometer buffer zone, 3-kilometer container.
Maybe an entire ward would be a containment zone.
Containment zone, and then a 5-kilometer buffer zone that has now come down to 100 meters. In fact, now we have gone down and said that each individual house will be a containment zone in itself,
So
which is an independent house.
So that restricts people who may be affected or who are infected, but without stopping.
Without stopping
So
the
it can
normal-
even be a
normal-
house. Even a house can be a containment zone, no longer ward basis. So that has really helped in
Yes.
terms of.
In fact, what we are now promoting is that the concept of reverse isolation. What we are saying is you must ensure that people who are elderly, people, children who are within 10 years of age, then people with comorbidity conditions, they are the ones who are more vulnerable, and they need to be isolated from the persons who are going outside for work and other things. So the concept of reverse isolation is that they must be protected first. So you protect your family members by isolating yourself within the house itself. So that is the concept of reverse isolation.
Reverse isolation, protecting the vulnerable from people who may be carrying them infection. Another big issue is, of course, quarantine. Karnataka has been fairly strict on quarantine, and we're looking at the 7,000 cases in the state, with maybe 4,300 plus from Maharashtra alone. Quarantine, has that played a huge role, do you think, in keeping the spread down in the city?
Yes, of late, if we see the post lockdown unlock 1.0 phase, if we see the cases that have identified are majorly in two categories. One is primary and secondary contacts, which are already under institution quarantine.
So they cannot spread.
So the spread has been reduced to almost nil or zero there. And there is also another category where, because of travel history, there is a source of transmission. Here also we have institutional quarantine. So almost 60% of the cases which are post June 1st to June 14th in Bangalore, all the cases have been identified from the institutional quarantine lot. So that actually helps us to ensure that the quarantine protocols are strictly followed and monitored closely.
That has really helped. And of course, this is a government initiative, it's a state government initiative, and there has been a lot of work being done by the government. But private collaborations with private organizations, has that helped a lot, do you feel, in terms of tackling COVID-19 in Bengaluru?
Yes, it has come in very handy for us to ensure that the home quarantine is maintained.
Okay.
You know, a normal practice is that once people go into the home quarantine, it's difficult to keep a track of them, and there's no way to ensure that they go that they do not go out. So what we have done is we have engaged with the resident welfare associations. We have about 750 resident welfare associations in our city, and we have reached out to each and every one of them and made sure that they become our eyes and ears on the ground, and they ensure that whoever is supposed to be under home quarantine is really under home quarantine. In fact, I have been getting complaints contrary that the RWs are so strict that people are not even allowing the domestic help to come in and work for them. So that is the kind of citizen engagement we have had. The second area where we have had excellent citizen engagement is in the area of migrant, solving the migrant population who are wanting to go back to their home states. That is where a lot of our NGOs came in with us and chipped in and helped in providing food kits and cooked food to the migrant population who were, under severe distress.
Absolutely,
especially during the lockdown period.
You're speaking about neighbors alerting in case anyone is violating quarantine. That, of course, has had some kind of feedback in terms of this is snooping, this is getting people to spy on each other. Have you had that kind of resistance, that sort of feedback?
No, I do get complaints that people are not, the RWs are not allowing them to, go out and all that. And they're interfering too much. But I have been able to tell them and convince them that it's for their own good. Because if somebody who's, infected and comes into their complex, residential complex, they run the risk of infecting everybody else in the apartment complex, and so it is better that we are more strict in the initial stage than regret later.
Now, another question that arises when we come to low figure, is there enough testing being done? Is Bengaluru doing enough testing? Is it low testing that is leading to low figures?
Here I would like to indicate at the positivity rate that is there in Bengaluru. We have recorded 1.2% positive rate as on date. So if you take the number of tests, which is over 62,000, and the number of cases that have turned out positive, I think we are one of the least positivity rate cities again in the national scenario. If we look at the Karnataka numbers also, we are almost on par or a little lesser in terms of the positivity rate.
But enough tests are being done, you feel? It's not as if figures are being hidden because of low testing. Are enough tests being done?
Tests are being done. Also, in case of BBMP, the War Room has taken under the leadership of Commissioner BBMP a very unique method to actually do the random sampling testing. We have identified adaptive stratified random sampling method where we actually factor in what are the new variables that emerge on field, be it the case of ILI SARI, which has cropped up of late. Every factor that is found on ground is being dynamically absorbed into the testing strategy, and we are evolving, trying to ensure that the tests that we do are also giving us the right leads and the right numbers.
That has been a recent concern, that this influenza-like illnesses are actually giving rise to, are also leading to COVID-19, and there has been concern about that. So that is being addressed also?
Yes, the factor of ILI SARI has also been taken into account with regard to testing strategy.
Testing strategy as well, it is
Yes.
being considered. And how serious is that right now at this stage, ILI and SARI?
It is serious in the sense that roughly 30% of the cases which we have traced in the last 14 days are from this category of ILI and SARI. And another 30% is from the patients who have, persons who have come from outside the state, interstate travelers, we would call it. So that way, if you see, it's almost equal. So that is a cause for concern. And what we have thought of in terms of strategy for the future is that we need to be proactive and not wait for the positive cases to pop up. We need to go out, identify what she was saying as anti-contact tracing. We need to identify which are the vulnerable
Not wait for possibilities, but to
not wait for the positive cases to come up, but to go out and see which are the vulnerable areas. Like markets is a major area, hospitals and medical establishments are a major area, hotels and restaurants are that, malls and supermarkets. These are all some, and slum areas. These are some of the areas which are vulnerable and which are having a high likelihood of having positive cases, which if we are not able to trace, pick them up and isolate, would lead to community transmission. So this is our strategy for the coming days.
coming ahead, because of course the city, the country, the world, they're opening up now, so there's more chance really. How are you tackling things like wearing of masks, dealing with spitting? The Chief Minister had in fact announced that Thursday will be a mask day to raise awareness. How are you dealing with that to get people aware?
Adhering to the national directives, where the three major directives are emphasized. One, with regard to wearing masks, BBMP is actually doing a campaign where you not only wear a mask, wear it properly, closing your nose and mouth. And the second directive with regard to physical distancing, and the third directive with regard to maintenance of protocols with regard to hand hygiene. These three national directives have been taken up very seriously, and we also have identified like the leaving no case untraced approach, which we started off with at the War Room in March itself. We have identified of late the leaving no citizen uninformed strategy, where we want to reach out and have this constant civic behavioral change campaign going on. So Thursday will be a start, and we will certainly ensure that all our citizens get the right information at the right time.
Thank you so much. So it's an ongoing process, it's an ongoing battle right here, headquartered in the War Room, as the Commissioner, Mr. Anil Kumar, and Ms. Hepzibah Korlapati shared some of the ways Bengaluru has been keeping its numbers low compared to other cities of comparable size. They've listed out what the city is doing right, and maybe other cities could pick up some tips from this. With DM Kumar, Maya Sharma in the BBMP War Room of Bengaluru for NDTV.